Good afternoon, everyone, and welcome to our Return to Work Town Hall Part 10. When we started these events in the spring of last year, I didn't realize we would get to Part 10, but we want to thank you for your time today. We think you'll find the information and the discussion today very, very useful as you're thinking about returning to work and returning to school over the next several months. My name is Ruth Christopolsky. I'm Senior Vice President of Population Health for Atrium Health, and I'm very, very pleased to be here today. And I think you'll really enjoy hearing from our speakers. Today's meeting really is a panel of experts that we've brought together that are going to answer questions around vaccines, the importance of vaccines, the efficacy of vaccines, and provide some other information on vaccines. We are recording today's event, and it'll be available following the town hall on our website. As always, we do have the live chat open for your questions. So if there's a question that you would like to have answered, please do put it in the live chat. We'll either get to it at the end of the meeting or we'll follow up after the town hall and ensure that you get an answer. Additionally, I did want to share some information with all of you around an event that we're having tomorrow evening from 5:30 to 7 p.m. Around vaccine hesitancy. And so if you have employees who are hesitant about getting the COVID-19 vaccine, we'd love for you to join our expert panel and listen about some of the tools, solutions, and conversations we're having around vaccine hesitancy. And as you can see, there's a link available to register for the virtual event. We'll also push this slide deck out to everybody. And so you can use the link in the slide deck after the event today. So again, I let you all know that we have a wonderful group of participants that I'm going to have the opportunity to ask questions to. And so I'd like to introduce them before we start. We have Dr. Katie Passaretti, who is our Medical Director of Infection Prevention and all things COVID at Atrium Health. And our community, our organization, our patients have been blessed to have Dr. Passaretti over this last year or so, helping us lead through the pandemic. We also have Dr. Gary Little, who's a Senior Vice President and Chief Medical Officer for our Greater Charlotte region. And Dr. Little serves a number of roles, and one of those roles is he's the king of testing and the king of vaccines. So he's really leading our internal groups on our testing strategy, operations, and deployment. And he did such a great job in the testing realm that he was asked to do the same thing in the vaccine realm. So we have the wonderful opportunity of working with him almost on a daily basis as we look at vaccines and vaccinating our community for COVID. We also have Dr. Chris Turley with us. Dr. Turley is the Vice Chair of Research for Levine Children's. And in addition to that, she is leading all of our research around vaccines for COVID. And Dr. Turley has done a tremendous amount of work around the vaccine registry, as well as providing up-to-date information and education on vaccines, vaccine hesitancy, and everything scientific you've ever wanted to know about vaccines. So we're pleased to have Dr. Turley here. And last but not least, we have our favorite participant, Dr. Dave Casenza. Dr. Casenza works with us in Employer Solutions on a daily basis. He's our specialty medical director and has spent a lot of time helping us help our employer and school partners ensure that we have a safe environment for which to go to work and go to school and work and play. And so we have I think a star-studded panel today to ask questions. So welcome, everyone. I'm going to start with my first question on the importance of vaccination, and I'm going to ask Dr. Passaretti to respond. We're hearing a lot in the press, a lot on TV about vaccinations. And so just really broadly, Dr. Passaretti, why does there seem to be such a push for us to get as many people vaccinated as quickly as possible?
Yeah, thank you, Ruth. So, I think you'd be hard pressed to talk to anyone that hasn't been impacted by this pandemic, by COVID at this point in time. We're up to almost 450,000 deaths in the United States. This has gone on for way longer than we initially anticipated, and we continue to challenge our healthcare system. We've seen most recently with Thanksgiving, the holidays, and New Year's on top of that, increased case counts, increased hospitalizations, and increased deaths that have really kind of tested the limits of our healthcare system, and disproportionate impact to people with other medical problems, elderly individuals, and communities of color. In addition, we've seen that patients that have an infection can become infected again in the future. So it has become more and more clear over time that vaccination absolutely is an important part to getting this pandemic under control, returning to some sense of normalcy. The other thing I will say that's kind of applying some pressure and urgency on the situation is a lot of the news surrounding the variant or mutant strains that are associated with increased spread in the UK, South Africa, and needing to control the spread of COVID before those strains really take root and cause even more issues. So, just super important to get, especially those at highest risk, vaccinated, protected as soon as possible.
Thank you so much for that, Dr. Passaretti. Good point. If it's your turn based on the prioritization and the state that you're in, we want to encourage people to get vaccinated as soon as possible. I'm now going to turn over to the efficacy of vaccines. And now that we know why it's important, I'm going to ask Dr. Cosenza to answer, how long will it take once I receive the vaccine to actually be protected against COVID-19?
Hey, thanks, Ruth. So for the two approved vaccines currently available, the Pfizer and Moderna, it would take at least 2 weeks after the second dose of the vaccine to get to where, in their studies, they were able to prove about 95%-ish protection from COVID-19 when exposed to it again down the road. But it doesn't happen immediately. It doesn't happen to that level with just one vaccine. With any new vaccine, that it'll be something that we'll need to keep an eye on, but that's what's applicable to the two currently approved vaccines.
Thanks, Dr. Cosenza. And Dr. Turley, Dr. Cosenza mentioned, the two vaccine series for the Pfizer and Moderna vaccines that are currently available. Why is it important for a patient who has the first dose to get both doses?
So hi, Ruth, thanks. So our immune system is our defense system against new things that come along. And throughout our lifetimes, it's constantly learning. And so a vaccine is a way that we try to teach it about something new. So it's sort of like preparing it for a big test that might be coming up. And the first dose of the vaccine, it's showing that immune system something for the first time. It's like new material. It's like new material in a class, if you will. And the immune system is starting to learn. And it starts to produce a response, but it's not very sophisticated as it maybe needs to be, so that it can be a little bit of a better protection. So the second dose is timed for when that initial lesson to the immune system is done and it's starting to taper a little bit. And we give that second dose as a way for the immune system to get more practice. It gets better and faster at responding. And it also starts to develop some more memory of that part of the virus that it's seeing. And that combination is so important so that when the big test, when the actual virus comes along, our immune system is ready, it's highly organized, and it's really prepared. So without that second dose, that very robust memory-driven response it may not be very strong.
Thanks, Dr. Turley. So now we know that we need to get the second dose so that we can train our body to respond to COVID if we're exposed to it. But Dr. Passaretti, what if we've already had COVID-19? Do we still need to get the vaccine if we've already had COVID-19 from a disease process standpoint?
Yeah, currently the recommendation is even if you've had prior COVID-19 to get the vaccination. The rationale for that is that we've seen with COVID infection, natural infection along the way, not all infections are created equal. Some people have symptoms, some people don't. Some people produce antibodies or that sign that your immune system has kicked in, some lower levels of antibody. And we've seen instances, especially as we get further and further into the pandemic, of individuals who have been previously infected, who then develop infection again. That risk of infection is less the closer you are to your initial infection, but seems to definitively increase over time. So because of that risk of reinfection, really the recommendations is even if you've had prior COVID-19 to go ahead and get vaccinated. The one thing I will say is that individuals with recent infection, there's potentially less kind of urgency we talked about to getting people vaccinated in that first month or two after infection. We start to see the risk of reinfection increase around the 90-day mark. So, I think it's not, you don't have to, as soon as you get over COVID, immediately rush out, get your vaccine, though you certainly can as long as you're no longer infectious. But just know that as time goes out from initial infection, your risk of potentially getting infected again may increase, and that it's still recommended to get vaccination at some point in the future.
Okay, so I've listened to what you've all said, and I've gone out and I've gotten vaccinated, not one, but both, at least for the Pfizer, Moderna vaccines that are available. Dr. Cosenza, once I am vaccinated, do I still need to wear a mask, social distance, and wash my hands like I did before?
Yes, Ruth, at this time, even completing the 2 vaccine series, there's no change in recommendation to those factors. We are still encouraging and recommending both hand washing, mask wearing, and the physical distancing. So unfortunately, at this time, that has not changed. It is part of the protective measures that we need to do to keep this transmission at a minimum level as we can.
Thanks, Dr. Cosenza. Dr. Passaretti, here's a really good one. So if I'm vaccinated, is there still a chance that I could contract COVID-19? So even after I've gotten both vaccines, could I still get COVID?
Yeah, so that is a very good question. So the vaccines are extremely effective around the 95% level in protecting the individual who's vaccinated against getting symptomatic COVID. So 95% is amazing. It's way better than, honestly, we thought we'd be with a vaccine a year after the disease was discovered, but it's not perfect. So, certainly even after vaccination, and especially as has been stated earlier, that vaccine doesn't kick in for several weeks. You still need to monitor for symptoms, stay home if you're sick. Your risk of symptomatic infection markedly decreased, but nothing is 100% in the world of vaccines. So, make sure you're keeping an eye on your symptoms, watching yourself, and staying home if you're sick.
Thanks so much. So Dr. Turley, I know that the FDA provided emergency use authorization for both the Moderna and Pfizer vaccine. I know there's some differences to the age categories, but right now, can children get the COVID-19 vaccine?
So it's a great question, and we do know that children will need to get COVID vaccines at some point. Right now, only the Pfizer vaccine has been studied and approved down to children who are 16 and older. The Moderna vaccine has an adult-only indication, 18 and older. There are studies going on throughout the world now looking at these same vaccines in children. And normally we start in the older parts of adolescence and we work our way down. We sometimes also decrease the dose as well during that. And so those studies are occurring, and we're hoping to be part of one of the younger child studies here as well coming up. So soon more in this space.
Thank you very much. All right, Dr. Cosenza, this next one's for you. After an employee is vaccinated, do they still need to quarantine if they're exposed to a COVID-19 positive individual?
So thanks, Ruth. Similar to the PPE, post-vaccination, anybody who is exposed in a close contact would still be recommended to follow the appropriate quarantine period.
So you're recommending, and we're recommending, that even if a person's vaccinated, if they're exposed, they follow the current CDC guidelines for quarantine, correct?
Yes, correct.
All right, thank you. All right, Dr. Passaretti, another one for you. Does the vaccine offer protection against the new COVID variants that are circulating? We're hearing a lot about the UK variant and the Brazil variant and the South African variant. Can you talk a little bit about what that means, what the variant means, and then are the vaccines that we currently have, do they offer protection in the variant space?
Yeah, absolutely. So all respiratory viruses, including coronavirus, SARS-CoV-2, the virus that causes COVID, gradually mutate over time. This has been going on since the beginning of the pandemic, but to date, the mutations have been minor, didn't make a significant impact as far as how easily the virus was spread or how severe the illness was with the virus. The reason more recently this has come to kind of a lot more attention is that the virus seems to be picking up in these different strains more mutations in areas that are important. So all the strains that Ruth mentioned, UK, South Africa, and the Brazil/Japan variant, all have been associated with increased spread. So whereas like wild type or the prior versions of the COVID virus, maybe one person could spread to 2 people who are susceptible to the virus. The newer strains are increased spread by about 50%, so 3 people. Obviously, the more people infected, the more spread, that has downstream consequences as far as hospitalizations and deaths. The strains to date don't seem to be associated with significant increases in severity of illness. However, these are still new and that is still very much being studied. The UK variant, which is the one that we have seen the most of, and honestly has been found in the United States and a number of states, does seem to be fairly well covered by our current vaccine candidates without a ton of decrease in efficacy. The South African strain and the strain in Brazil have mutations that chip away at that vaccine efficacy. So it's anticipated that the vaccine will still provide some protection, but whereas, we said it's 95% is what was shown in the study, that level of protection may be a bit less for these variants. And, that's the way our immune system works, is it responds to a number of different kind of targets on the proteins. So it requires pretty significant changes in the shape of the protein it's targeting to completely evade the vaccine. So the information we have right now does not seem that we will completely lose vaccine efficacy with these strains, but may see some decreased efficacy. And again, we talked about it in the beginning, but the importance of getting people vaccinated, trying to prevent these strains before they get well-rooted is important, because there is the potential that down the road we may have a complete escape mutant, which means the virus has mutated enough that the vaccine doesn't provide protection. We're not there yet, but definitely something we need to keep an eye on.
Thanks so much for that. So, Dr. Little, I know that I get a letter typically from you every year as an Atrium employee to get my flu vaccine and to make sure I get my flu shot. Will there be the same requirement with the COVID-19 vaccine? Will a person need to get vaccinated every year from COVID?
Yeah, it's another great question we get asked often, and I think it somewhat ties into what Dr. Passeretti just talked about, and the reason people have to get the seasonal flu vaccine is because there are different strains of flu out there, and we're trying to predict what's going to be the dominant strain and vaccinate everyone before they get infected. And so, it really boils down to if we manage this pandemic through all the recommendations that have already been mentioned, if we can reduce the number of people getting infected, that reduces the number of mutant strains that get out there, and that keeps the efficacy of the vaccines we have to be against the virus, so that people aren't getting those strains, then it's likely that we wouldn't have to do that. So I think it boils down to what right now we're not sure. Some of it's dependent on again how the virus mutates over time, and if different strains are produced and the vaccine is left efficacious against those strains, then it's very likely that we will need to have a vaccine annually, just like we do with the flu. I think the other piece of this is how well our immune systems over time maintain our immunity to the virus. And so I think that still has to play out of how long this immunity lasts to the vaccines. Do we need boosters to kind of just stimulate our immune system, every 1 to 2 years or something like that? That still remains to be seen. But those are really the two factors that would weigh into whether we would need to get vaccinated every year.
Thanks a lot, Dr. Little, for that. Dr. Turley, as we're learning, right, we typically learn in healthcare by doing research, right, and looking at what's available and what comes next. Is there a way that our community can continue to support vaccine research efforts, again, to make sure that we have viable candidates and options for the people that we serve? I'd love to hear your thoughts on how some might be able to support vaccine research efforts that are underway.
Well, thanks, Ruth. I think it's an important part of the hope that we're all looking for as we're really grappling with this pandemic a year in. And this past summer, in the spring into the summer, Atrium made this decision that vaccine research was really important to our mission of health, hope, and healing. And partly that's because when we are doing vaccine research work here in our community, we can be increasingly confident about how the research is being done, that it's inclusive of people that are important to our community, and that we then end up having detailed firsthand knowledge of the science. So that's very exciting for us when we can bring it home right here to Charlotte. So currently we are working on the Novavax COVID vaccine trial, and that study we have close to just about 20,000 people in the country enrolled, and we've been enrolling here in Charlotte now since the beginning of January. We are still going to be enrolling for not quite 2 more weeks. So if there are people who are still interested in participating in an active vaccine research trial, that opportunity is available, and the information about contacting for that is on the website. Additionally, we established in this fall a vaccine research registry, and that's a way that people from across the community can sign up. It takes maybe about 5 minutes. We have it in English and in Spanish, but people can sign up to get information about vaccine research and to be considered for future trials. We know that COVID vaccine research is far from done. We're excited to be doing the Novavax trial because just last week, information got released specific to some of these questions about variants from the studies that are being done in England with that vaccine, the same vaccine we're studying, as well as studies that are happening in South Africa. And that vaccine was able to be very nicely protective against some of the variants, but again, at a little bit of a lower rate of protection than we're seeing for the one that's circulating widely. So we know there will be new trials looking at vaccines to cover those variants, and those are already in the development around the world. We also are going to be following people who get vaccinated to figure out the question that Dr. Little was raising. Do we need a booster dose next year? How long will the protection persist? And fundamentally, the sooner we can get people vaccinated around the world, the sooner we can keep the virus from circulating, because those variants happen when the virus is very active. And once you get a lot of people vaccinated, the virus stops being able to be active. It can't pass from person to person. And it's that passing that introduces the chance for these variants to happen. So it's partly why we're trying to get these vaccines done and approved quickly, and why we need so much support from our community to volunteer for these trials as they're coming online. It's been incredible to see the interest in Charlotte, the outpouring. Thousands of people have signed up for the registry, almost 10,000 now, and we have had a great response to participating in the Novavax trial. So we're really excited about having that work happen right here at home.
Thank you, Dr. Turley. Very exciting. And again, I think we're all learning as we go, and we appreciate you leading us as we're learning. Our next set of questions are around safety and the safety of the vaccines. And we're hearing a lot of information, and again, in the press, we do have, questions from a hesitancy standpoint. So let's just answer some high-level basic safety questions. And so, Dr. Passaretti, I'm going to give you the softball to hit out of the ballpark here. Can you get COVID-19 from the vaccine?
Nope, no way, no how, not from the current vaccine candidates. They really just give instructions to your cells on how to make one protein associated with the virus. So there is no way that the currently available vaccines or any of the future ones that are anticipated to be available can give you COVID infection. I will say, obviously, we're still seeing very high rates of COVID in our community. So, certainly it's possible to get COVID from a source in the community, exposure, whatever, at any point, but particularly when you're, soon after your first dose, between your first and second dose, or right after your second dose, that's completely unrelated to the vaccine. It's just, true unrelated.
Thank you so much. So Dr. Turley, back to you. We know that the process for approval for the COVID-19 vaccines, the two that are currently under emergency use authorization, as well as, some of the ones that are coming forward, were approved more quickly than other vaccines in the United States and in our history. Why is that, and how do people know that it's safe even though it was approved quickly?
So there are two parts of why it got approved quickly. The first is that we're awfully lucky that this has come along at this point in time, because we have about 70 years of modern vaccine science that is underpinning the work that's happening right now. And each of these vaccine candidates that are coming forward that have emerged quite quickly, parts of those vaccines were in the development process, and parts of them were being used with other viruses before this came along. So there was a fair amount of pre-existing information about kind of the core components about those vaccines. The second part about what has made this happen so fast is that it's an incredible thing when people come together with a common purpose. So normally in the scientific process, when we're developing a new vaccine or a new drug or lots of new different things in medicine, different parts of that process, of that pipeline, the scientists, the regulators, the clinical investigators, the government, that pipeline, it doesn't always line up. There are lags that are in it because each part of the pipeline may have slightly different priorities, a little bit of a different agenda at any one point in time, and there are lags that happen because of that. There are just gaps in time and gaps in the progress that occur, and those can drag out for a couple of years when you're thinking about vaccines or new drugs in that process. This process for COVID vaccine has been amazing because all of these parts of the pipeline have come together around common purpose. It is such a priority for everyone who is involved in this work that there's people are working nights and weekends and holidays at any time, so that whenever the handoff comes to the next phase of the pipeline, the team is ready and they are primed. They have done all of the background work and they are ready to jump in at the deep end with their step of the work. That's what happens in an emergency like this. It's been incredible, I think, for us all around the world to see that we would have not one, but two vaccines in our country right now that are so successful, and we have additional ones coming along. That's nothing short of just absolutely incredible, and an incredible testament to what we can do with common purpose.
Wonderful. So we know that the way that these vaccines work are a little bit different than how vaccines have worked in the past. And does the vaccine itself alter an individual's DNA, Dr. Turley, or can you explain exactly how it works?
Sure. So the two vaccines that are approved right now, the Moderna and the Pfizer vaccines, they have messenger RNA in those vaccines, and that messenger RNA is it's a little message. It's a little bit of a recipe, if you will, that is being given to our bodies and that's taken into our cells, and it goes into the part of our cell that is not where our DNA lives. It goes into the cytoplasm of our cells, and those messages are read there. Our bodies do this all the time. We read these messages regularly, and then we discard them. They don't hang around forever. And that's a process that our cells are quite good at, of reading and executing what that message is, and then getting rid of the message. Those don't get saved. They don't get internalized. That process plays out over and over again in each of our cells all through our lives. So there's no worry that this is going to become part of our DNA. But it's a sort of a fascinating advance. And again, it's enabled because we do have these advances in our understanding of the way our genetic code works and the way it translates into action in our bodies.
Thanks very much for making that really understandable. I learned quite a bit through that. So Dr. Little, we're going to talk a little bit about side effects. And I know that you've received a vaccine because you're running major mass vaccine events. So what types of side effects can someone expect when they get the vaccine?
Yeah, this is, I think, important because I think expectations, one can either, the wrong expectations can generate fear for the vaccine, which we don't want. Yeah, I think the most common side effects that we're seeing reported, and they seem to be a little bit less with the first dose of the vaccine than the second. I think there's more common side effects with the second dose, but I think majority are, soreness in the arm at the site of the injection is a very common one. We also hear a lot of people who say they may feel fatigued after getting the vaccine. Some report body aches or muscle aches. and even some might report feeling a fever or chills. Those are really the common symptoms we're seeing after the vaccine, and as I said, majority of them really after the second dose. They typically start about maybe 8 to 12 hours after the injection, especially those body aches, the chills, the fatigue, and generally by about 24, maybe as far out as 48 hours, but generally most people say within 24 hours or so that they feel completely back to normal. And it's important to just say that this is a normal reaction to the vaccine. It really means that your immune system is working, and that's what's giving you these symptoms. Younger people maybe see it more often than older people, but we've certainly seen it in all age groups. But I think the important thing to know is this is completely normal after receiving the vaccine.
Thanks so much. Dr. Passaretti, I know early on there was a lot of media attention around people having, significant side effects afterwards, including, anaphylactic reactions. Can you talk a little bit about the percentage of people who have those really severe side effects, and then things that are being done to mitigate in the vaccine events that are occurring?
Yeah, sure. Well, what Dr. Little was just talking about, muscle pain, tired, low-grade fever, feeling a bit run down, headachy, those type of side effects are common. Serious side effects are extremely rare. So the ACIP, which is the kind of CDC immunization branch, updated all the kind of safety data now that vaccines are getting out to more and more people in the United States, and the rate of anaphylaxis following vaccination is somewhere between 3 and 6 per million. So very, very rare events. The things that are done, anaphylaxis occurs within close time proximity to when, the thing that you're allergic to is introduced. So, sites obviously take a good history for whether you've had an allergic reaction, and the allergic reaction is really thought to most likely be due to a reaction to something in the fatty coat around the mRNA called polyethylene glycol. So it's not something that if you have a history of an allergic reaction to foods or shellfish or latex or, seasonal allergies that you're at risk for this. It's really a very small chunk of the population having this side effect. And, this is the reason that all the vaccination sites ask people to stay there for, depending on your kind of history, 15 to 30 minutes after the vaccine, because that's the time frame when, if you're going to have an allergic reaction, will happen. All vaccine sites have medications to be able to treat that, and medical professionals on site that can respond in the rare instance that should happen to mitigate any side effects. And to date, that has all those treatments have been successful in the rare instances where an allergic reaction occurred on site. I will say if someone does have like an immediate severe allergic reaction to the first dose, right now, we recommend not. This is the one case where we might say, okay, hold off on that second dose, and let's, there are more vaccine candidates that are coming down the road. Those may be a better option for that very, very small subset of individuals.
Thank you. So it sounds like it's very, very rare, and the majority of individuals have access to healthcare services should something happen at the vaccine sites. Okay, Dr. Cosenza, Dr. Little talked about the types of side effects a person can expect after the vaccine. How long do they typically last?
Thanks, Ruth. I think Dr. Little covered it a little. Most of the time it's 24 hours. I would say probably no more than 48 hours for typical side effect symptoms from the vaccine, and symptoms that are persisting longer than that may need to be investigated, and in some situations, depending on if it's the first or even the second vaccine, since they don't offer full protection, it is possible to get COVID and just coincidentally come down with your symptoms right after your vaccine. So if it's more than 48 hours, the people should probably be seeking care and potentially COVID testing.
Thanks so much. So our last section really is focused on vaccinations at Atrium Health and the work that Atrium Health is doing in order to help our community get vaccinated. And so, Dr. Little, I'm going to start with you. What is the best way for individuals who want to get vaccinated at Atrium Health?
Yeah, so I think the first thing to understand is, vaccine supply is still very limited, as you all probably see on the news. We get allocated a certain amount of vaccine each week, and we use all that vaccine to try to vaccinate as many people as we can. So and the eligibility criteria in the state right now, still only 2 groups being vaccinated. Group 1, which is healthcare workers who are providing care to patients, and then long-term care healthcare, health workers who work in skilled nursing homes, those kinds of things, and then obviously the patients who live in those long-term care facilities. So those are really the only 2 groups right now who are eligible to be vaccinated. But the best way to get vaccinated by Atrium is really to go to our website, which is atriumhealth.org /COVID-19 vaccine. And if you go to that website, it has a lot of information about the vaccine, a lot of the information we're providing here today. But it actually will ask you, there's a questionnaire on there that if you answer that, it will help to tell you when you're eligible to get the vaccine. And then when your chance comes up later, when the state opens the eligibility criteria, we'll reach out to you to help get you scheduled to get that vaccine.
So if an individual, Dr. Little, fills the form out and it's not their turn, but their turn comes out, we'll automatically reach out to them, correct?
That's correct. Yep. We got your information in there. We'll contact you.
Sounds wonderful. So Dr. Casenta, this is always a question people ask. How much does the vaccine cost?
At this time, there's no out-of-pocket expense for anybody getting vaccinated, and not being able to pay for it is not something that should keep people from getting vaccinated, as the person getting vaccinated should expect no cost to them.
Thanks very much. So, Dr. Little, I know this is a question you and I have talked a little bit about. We live close to a state line. So if individuals from out of the state, including South Carolina, come to one of our locations in North Carolina, will we vaccinate them?
Yeah, we will vaccinate anyone who has an appointment at one of our vaccine clinics or events. Doesn't matter what state they're from, and in fact, we've seen people from all over the state of North Carolina, South Carolina, even beyond. I think as people are trying to find access to the vaccine, they're moving their family, living with family, or whatever it might be. So we're vaccinating anybody who has an appointment and they're in one of those state eligibility groups. We will vaccinate them. And in fact, it's behooves us to vaccinate more people, because it shows the state and the feds that, hey, we're utilizing the vaccine that they give us. And then that just means that we're a proven, commodity to be able to give vaccine out at a high rate. So it actually helps us. And the other important thing people ask is, do I need to have an Atrium Health doctor, and those kinds of things? And no, you don't have to have an Atrium Health doctor. While we're more than happy to have you switch to an Atrium Health doctor, you don't have to have one for us to vaccinate you.
Thanks very much for that. I'm going to do a couple more follow-up questions, and this is really complex, so just going to put it out there, and then you can help us think through it. So if I got my first vaccine dose somewhere else, can I get my second dose at Atrium Health, and vice versa? If I got my first one at Atrium Health, can I go somewhere else to get my second dose?
Yeah, there's unfortunately not a simple way to answer this question. Logistically, yes, you could do it, and I'll explain what I mean by that. One of the things that we did, we found it to be better to book both of our appointments for your first and second dose at the same time. So when we schedule you for a vaccine with Atrium, you're getting both appointments together. And that's a big reason why we have a very low no-show rate for second dose vaccines, because people are already booked in. We guarantee that you'll have a second vaccine dose when you come for your second appointment. Some other vaccine providers have not done it that way, and then I think that leaves some people a little bit out in the cold when it's time to get their second dose. So what the problem becomes for us then is, for every first dose we give, we've got a second dose that's matching. So if we get somebody who didn't get their first dose with us, then we don't really have a second dose to match for them. So that kind of throws things out of whack for us at this time. So we are working with the state, though, to kind of figure this out, because we've had a number of people reach out to us and try to schedule their second dose with us. So I anticipate that will change as the state is updating its systems to be able to just give a second dose for somebody who got their first dose somewhere else. But at this time, we really don't have a way to do this. But I anticipate that will change in the coming days to weeks.
So currently we are scheduling both appointments at the same time for
Correct.
folks that schedule through us. So if you get a first dose, we have the second dose for you. So I think that will give folks some comfort.
Yeah, I think that ideally people should try to stay with the same vaccine provider. I know as the eligibility criteria changes, people are looking at different states and things like that to see when they can get it earliest. But it does present these problems on the back end. So my advice would be, to try to stick with the same vaccine provider. It's just going to make things easier for you in the long run. And like I said, we book both at the same time. So when you book your first, you know exactly when you're going to get your second dose with us.
So I know that we have a number of sites across the Atrium footprint. I think the last time I checked, there were 6. Do we have any plans to expand vaccine sites? And then if you can address a question that I get all the time, why don't we have any vaccine sites in South Carolina?
Yeah, so good questions. Yeah, we have lots of plans to expand. We would love to have more sites, but as I said, it really at this point is a limitation of the vaccine supply. So I expect as the vaccine production picks up, as additional vaccine types are available, that we'll open up more access and sites as that happens. As far as why we don't have anything in South Carolina, it's because currently there's only a couple providers that can give vaccines. So one is hospitals and health systems. The other is county health departments. And then there, obviously the CVS and Walgreens who's giving it to long-term care facilities and residents. So the big reason is we are a registered vaccine provider as a health system in North Carolina. We're registered with the North Carolina state vaccine program. We don't have a hospital in South Carolina, so we're not registered as a provider, a vaccine provider in South Carolina. So that's why we can't take North Carolina vaccine supply and take it to South Carolina. If South Carolina folks come to one of our vaccine sites, as I said previously, we're happy to vaccinate them, but we can't take it into South Carolina. And that's just a rule of the vaccine program. As more vaccines available and doctors' offices can be vaccine providers, then we can start to register some of our practices in South Carolina potentially as a provider, and we'll be able to provide vaccine there.
Thanks so much for your answer there. Those are the questions that I had prepared for today. I want to thank all of the participants. I know I'm gonna pass it over, but before I pass it over, I do want to share with our guest some resources that Atrium Health has. So one of the things that we talked about was side effects to the vaccination. And what I wanted to let folks know is that we do have a centralized number that individuals can call, 704-468-2000, and we have pharmacists and nurses available to help people manage their side effects and then to determine whether they need to seek additional care. Of course, as always, if you have emergency type side effects, we would want people to go directly to the emergency department. But we do have some centralized resources to help people learn more about their side effects and then learn how to manage them. In addition to that, Dr. Turley talked about the vaccine registry. We want to encourage folks to continue to sign up for the vaccine registry. The sign up is redcap.link/strive-registry. If you have questions, you can also call the number. We will share the slide deck with you. There's also a QR code that takes you directly to the sign up. So would love to have you share this information with the individuals that you lead. We learn a lot through the registry process and have the ability to push information out to folks. So that's very, very helpful. And then in addition to that, we have general COVID-19 information that's consistently updated by local, state, and federal guidelines and information at atriumhealth.org/coronavirus. If you have specific questions that you would like us to answer, you can also contact us directly at COVID-19RTW@atriumhealth.org. We monitor that website and that email box on a regular basis, so one of the team will get back to you. Megan, I believe you are now going to lead the group in some questions and answers that have come in from the audience.
Yes, thank you so much, Ruth. And thank you to the audience. The live Q&A function has been very active. We have over 26 fantastic questions in there. We won't be able to address them all live right now, but we do promise that we'll get you a transcript of the questions and our responses to everybody that participated today so that you'll be able to see all the great information that's being requested of us. I did want to ask our panelists and specifically start with Dr. Passaretti. You know, we talked about the immediate side effects, but what do we know, or what do we not know about long-term effects of the vaccine?
Yeah, so clearly, you know, COVID has been around just over a year in the United States. The vaccine's been around and studied for less than 6 months. So, you know, while I would love to have 5-10 years of data to look back on, you know, we don't have the luxury of that in this situation as we're facing this ongoing pandemic. You know, what we can say based on what we know from prior vaccine studies, use of vaccines, as well as mRNA mechanisms for treatments and other vaccines, is that, you know, we don't anticipate long-term side effects. mRNA is new to many people, and you know, the COVID vaccine absolutely is new to many people, but mRNA for treatment of things like cystic fibrosis, cancer therapeutics, and even studying some other types of vaccines has actually been around for 25 years. So while the COVID vaccine is new, mRNA and its use in treatment and protection is not that new, and we haven't seen long-term side effects using that type of technology. And then, you know, what we know from other vaccines is that the side effects tend to occur in closer proximity to when the vaccine is given and decrease over time. So the mRNA, you know, degrades relatively rapidly. It doesn't stay in your system, kind of spurring things on to cause long-term side effects. So, you know, absolutely, we'd all love to be in a different place, not in the middle of a pandemic, but unfortunately, we're in this situation where, you know, weighing the risks of the unchecked pandemic, you know, COVID infection, and the theoretical risks long-term of vaccines as we get further and further out, is one that we don't have a ton of luxury to kind of wait around for the long-term stuff.
Great, thank you so much. And so another question, maybe Dr. Turley, if you can take this one, or any other panelist. There's a question around the two vaccines. So one is the Moderna and the other is the Pfizer. So is there a difference? Should I pick one over the other? Does it matter? So Dr. Turley?
Sure, it's a great question, and people are wondering, how do I pick and choose between the vaccines? And I think the answer is just say yes, because what we really care about with the efficacy of the vaccines is, do they protect people against severe disease? And one of the things that's really compelling is that in all of the vaccine studies that have been with data released so far on the initial 4 to 5 candidates that are coming forward, including Moderna and Pfizer, the vaccines have been protective against death and severe illness, and that is the bottom line for everybody with COVID, right, is the protection against the severe illness, the hospitalizations, and death. That's what the outcome ultimately that we really want with the COVID vaccine. So the slight differences that people might see in 94 versus a 95, for the individual, it's a meaningless difference. Even a difference of, say, an 85 to a 95, again, it will be a meaningless difference, because the sooner you can get a vaccine, the better you will have protection against serious COVID disease. And we are at a point where we are hoping to get as many people covered as quickly as we've been talking about, and trying to weigh and discern between these slight differences is not going to add value for any individual. It will just be a source of delay. I think the other issue is that there will be different types of vaccines coming forward. The AstraZeneca vaccine, the Johnson & Johnson vaccine, and the Novavax, they're all slightly different technology than the Moderna and Pfizer. And those are just means that the vaccines have different ingredients. They affect our immune systems in slightly different ways. But we're really looking for the efficacy and the safety, and those are the key hallmarks that are being part of all of these approvals.
Great, thank you so much. So we're closing in on time, and there is a theme that runs through a lot of these questions. Dr. Cosenza, I'm going to direct this to you, and it's a hard one, so I'm prepping you, but you have answered it once in the chat. There's a lot of interest on on-site vaccination clinics, and I know if we all could have our way, we would love to do that. Can you let us know kind of where we are with that process?
Sure, Megan, and thanks, and you're right, it was a common theme. So, you know, at this time, given the challenges in vaccine supply and kind of the necessary steps to be a vaccine administrating site, we are not able to go on site to employers and administer vaccines. It is a common request that we get, and one that we are working in preparation for a time when we could do that. We don't have a definite date. A lot is being worked on, but right now we are able to vaccinate at our current sites. Dr. Passaretti put in one of the comments that we have been able to launch a roving site for underserved populations, but going to an employer to do a specific employer vaccination site is just something that we can't do in current state, but one that we are striving to achieve, but I don't have a firm timeline.
Great, thank you so much. So we are now at the close of our session, and as I noted, there are several more wonderful questions in the Q&A that we will work to get responses out to the group for. And I think, Kim, next slide is just a closeout slide. We want to thank everybody for participating today, and I'll turn it over to Ruth just to close us out.
Yeah, so thanks everyone again for your time. Thank you, Dr. Turley, Dr. Little, Dr. Passeretti, and Dr. Cosenza for your guidance and wisdom. We do understand the desires of our employers, school, and other partners in getting as many people vaccinated as possible. And I can tell you that Dr. Little and Dr. Cosenza and I are working on a daily basis to ensure that when vaccine supply becomes available, we can be a partner with you in order to get as many of your teammates and family members vaccinated as possible. So know that we're working hard on it behind the scenes, and as availability becomes greater, we hope to be your partner in getting as many people vaccinated across our communities. We probably will be doing another event in the next few weeks as we get more vaccine candidates out. So stay tuned and look for another invitation from us. And in the interim, please be safe, wear your mask, social distance, and wash your hands often. Be well, everyone.